A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 milligrams, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If after performing the primary survey, you find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and two fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest will rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there's someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask a caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available, continue CPR while the instructions from the device are followed by your helper. And that's how we perform CPR. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. When bleeding is severe, it can be traumatic and distressing. If someone's bleeding isn't controlled quickly, they may develop a life-threatening condition called shock, and they may become unresponsive. Bleeding from the mouth or nose may affect their breathing, so try to ensure that the airway is kept clear. Obstructed airway can be a cause for a casualty to become unresponsive. If the casualty becomes unresponsive at any point, open the airway and check their breathing and prepare to treat an unresponsive casualty. To treat someone with a severe bleed, put gloves on if you have them, as this will help to protect you both from infection. If the wound is covered by clothing, remove or cut the clothes to uncover the wound. Is there an object in the wound? If there is, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, leave it in and apply pressure on either side of it to push the edges together. If there is no object in the wound, apply direct pressure on the wound with your fingers and use a sterile dressing or clean, non-fluffy pad to stop the bleeding. If you don't have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Jenny, can you apply some pressure for me, please? Brilliant, excellent, well done. Ask a helper to call 999 or 112 for emergency help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. The casualty may develop shock, so help them to lie down on a blanket or rug if there's one to protect them from the cold. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Jenny, could I lay you down? Excellent. Just going to lift your legs up. Is that okay? Secure the dressing with a bandage that is firm enough to maintain the pressure but doesn't cut off the circulation. So I'm just going to apply this dressing to the feet. Now take your hand away. Well done. Okay. Okay, hold up for me. Excellent. Okay, good at this. Okay. Check the circulation by pressing a nail bed or skin beyond the bandage for 5 seconds. Release the pressure. And if the color does not return within 2 seconds, the bandage is too tight. If blood shows through the dressing, don't remove it. Just apply a second bandage on top. Okay, can I have this? Lovely. Okay, excellent. If blood shows through both dressings, remove them and apply a fresh bandage, ensuring there is direct pressure applied at the point of bleeding. Support the injured part with a sling or bandage, but check circulation every 10 minutes. Keep monitoring the casualty's level of response while waiting for help to arrive. So remember, when treating severe bleeding, wear gloves if available. Remove or cut away any clothing from around the wound. Check for objects in the wound, but don't remove them. Apply pressure on either side of the wound. If there is no object in the wound, use a dressing or pad and apply direct pressure to the wound. Call 999 or 112 for emergency help. Secure the dressing with a bandage. Treat the casualty for shock. Support the injured area. Keep checking their level of response while waiting for help. And that's how we treat someone with a severe bleed.
Shock is a serious life-threatening condition that happens when vital organs in the body are not getting enough blood flow, and this can lead to failure of these organs and the heart. Shock can be caused by anything that reduces the circulation or blood flow, such as severe bleeding, which you may be able to see, or it may be hidden and internal. If the heart is unable to pump blood around the body after problems like a heart attack, severe heart disease or heart failure. Loss of bodily fluid following severe vomiting, diarrhea or severe burns. After a severe allergic reaction or severe infection. And following a spinal cord injury. These conditions may all lead to life-threatening shock. When someone is in shock, they may have a fast pulse, pale, cold or clammy skin, sweating, fast, shallow breathing, grey-blue skin, especially inside the lips, weakness and dizziness, nausea and possible vomiting, thirst. As the shock becomes more severe, they may have a weak pulse that you may not be able to feel, restless and aggressive behaviour, gasping for air, they may become unresponsive. To treat for shock, you need to try to reverse the cause of shock. If you find severe bleeding or serious burns, try to treat these whilst reassuring the casualty. Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with a blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if you think someone is in shock, treat the cause of shock. Lay them down and raise their legs. Call 999 or 112 for emergency help. Loosen any tight clothing and keep them warm and calm. Monitor their level of response. And that's how we treat shock.
Burns and scalds are damage to the skin caused by heat. A burn is usually caused by dry heat and a scald is caused by wet heat. You need to stop the burning by cooling the burn as soon as possible. This will decrease the severity of the injury. If someone has a severe burn, they may develop shock, which is a life-threatening condition, and they will need to get to the hospital as soon as possible. There are 5 signs which may be seen when someone has a burn or scald: red skin, swelling, blisters on the skin, peeling skin, or the skin may be white or scorched. If someone has a burn or scald, move them away from the source of the heat to stop the burn getting any worse. Then start cooling the burn as quickly as possible. Place it under cool running water for at least 10 minutes or until the pain feels better. Don't use ice, gels or creams, as this could damage the tissue and increase the risk of infection. If the burn looks like a serious burn, or it's to a child, it's larger than the size of the casualty's hand, it's a burn to their face, hands or feet, or if it's a deep burn, then call 999 or 112 for emergency help. If possible, get someone to do this for you while you continue to cool the burn, or use a speakerphone if you're on your own. Gently remove any jewellery or clothing near the burn, unless it's stuck to it. When the burn has cooled, cover it lengthways with cling film. Get rid of the first 2 turns of film and then apply it lengthways over the burn. Use a plastic bag if you have no kitchen film. This will protect the burn from infection. Never burst any blisters which may have formed, as this may increase the risk of infection. Do not use ointments or fats to treat the burns, as this may increase the risk of infection. Special burns dressings and gels are not recommended. You may also need to treat the casualty for shock. So remember, when treating burns and scalds, move the casualty away from the heat source. Place the burn under cool running water for at least 10 minutes. If it's larger than their hand, a deep burn, they're a child, the burn is on their face, their hands or their feet, call 999 or 112 for emergency help. Treat them for shock if necessary, and that's how you treat a burn or scald. A break or crack in a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack or bend quite easily, a bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secure, cover any wounds, call 999 or 112. And that's how you treat someone with a fracture. A stroke can occur when the blood supply to the brain is disrupted and starves the brain of oxygen. Strokes are most commonly caused by a clot that blocks the flow of blood to a part of the brain, although some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. Call 999 or 112 for emergency help immediately if you think someone has had a stroke. If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth or eye. They may be droopy and can't smile evenly. A, arm weakness. Ask them to raise both their arms. They may only be able to raise one. Can you raise both arms for me, please? S, speech problems. They're unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question such as, what is your name? Can they respond appropriately? Can you tell me your name, please? T, it's time to call 999 or 112 for emergency help and tell them you suspect a stroke after using the FAST guide. While waiting for help to arrive, keep them comfortable, supported and reassure them. Do not give them anything to eat or drink because it may be hard for them to swallow. Keep monitoring their level of response until help arrives. If they become unresponsive, prepare to treat for an unresponsive casualty. So remember, to help someone who has had a stroke, use FAST. Facial weakness, arm weakness and speech problems means it's time to call 999 or 112 for emergency help. And that's how you help someone who's having a stroke. If you think an adult or child is choking, ask them, are you choking? Cough it out. If they are coughing, encourage them to continue as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist, grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they are not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. Diabetes is a long-term medical condition where the body cannot produce enough insulin. Sometimes people who have diabetes may have a diabetic emergency where their blood sugar becomes either too high or too low. Both conditions are potentially serious and may need treatment in hospital. Hyperglycemia is where the blood sugar levels are high. It may be caused by a person with diabetes who has not had the correct dose of medication, may have eaten too much sugary or starchy food, or they may be unwell with an infection. A person with hyperglycemia may have a medical warning bracelet, warm, dry skin, a rapid pulse and breathing, fruity sweet breath, extreme thirst, or drowsiness leading to them becoming unresponsive if not treated. This is also known as a diabetic coma. Call 999 or 112 for emergency help and say you suspect hypoglycemia. While you wait for help to arrive, keep checking their level of response. If they become unresponsive at any point, open their airway, check their breathing, and prepare to treat an unresponsive casualty. Hypoglycemia is where the blood sugar levels are too low. It can be caused by an imbalance between the level of insulin and the level of glucose in the blood. If a person who is receiving treatment for diabetes misses a meal or takes part in a lot of exercise, their blood sugar level will fall. On rare occasions, low blood sugar levels can occur after binge drinking and after having a seizure or epileptic fit. People who suffer from diabetes may recognize when a hypoglycemic episode is coming on or starting and know that they need to eat something to bring their blood sugar level up. They may have their own blood testing kit to check their blood sugar level, but sometimes they may fail to recognize their symptoms in time, and without help, they may quickly become weak, confused, and unresponsive. A person with very low blood sugar, hypoglycemia, may have a medical warning bracelet, weakness, faintness or hunger, confusion and show irrational behavior, sweating with cold, clammy skin, a rapid pulse, palpitations, trembling or shaking, or may be less responsive to you. If you suspect hypoglycemia, help the person to sit down. If they have their own glucose gel or glucose tablets, help them to take them. If not, you need to give them something sugary, such as a 150 milliliter glass of fruit juice or non-diet fizzy drink, 3 teaspoons of sugar or sugar lumps or sugary sweets, for example, 3 jelly babies. If they improve quickly, give them more of the sugary food or drink and let them rest. If they have their blood glucose testing kit with them, help them to use it, check their blood sugar level and stay with them until they feel completely better. If they do not improve quickly, look for any other reason why they're unwell and then call 999 or 112 for emergency help. Do not give them anything to eat or drink as they may choke. While waiting, keep checking their level of response. If they become unresponsive, open their airway, check their breathing, and prepare to treat an unresponsive casualty. So remember, if they have hyperglycemia, high blood sugar levels, call 999 or 112. If they have hypoglycemia, low blood sugar levels, and are alert, give them a 150 milliliter sugary drink or 3 jelly babies. Sit them down and let them rest. If you're unable to give them this and they don't improve quickly, call 999 or 112 for emergency help. And that's how you help somebody having a diabetic emergency.